Good afternoon. My name is Kashonda Carpenter, and today I'm going to be giving you my research speech, and it's going to be about understanding the basic dental health from baby teeth to dental procedures. Have you ever wondered why children lose their teeth, or why we need x rays, or what's going on during a procedure and what type of procedures there are? Well, I'm here today to talk to you about that. I'm gonna walk you through some fundamental but important aspects of dental health. Children's teeth start to erupt by the age of 6 months. As of right now, I have a newborn who's 3 months, and I believe she's teething. So this is why I thought this would be a great research paper, a research speech to do. By the age of 3, she'll have all of her primary teeth. And by ages 6 to 12, they'll start to fall out and replace themselves. When children start to teeth, they're normally very cranky because they're erupting from their gums. They drool a lot and they need things to bite on, like little ice packs and things of those sorts. Even if your child doesn't have teeth, it's good to get them into the dentist just so they can get familiar with the sounds, a new face, and someone looking inside of their mouths. The reason that they lose the teeth is because the baby teeth are holding spaces for their permanent teeth. The reason they have teeth is to help them when they're learning how to speak and for chewing food. Also, what I learned is that children's teeth are by numbers A to T, whereas adult teeth are numbered from 1 to 32. Another reason I wanted to do this research speech is because I came across this great book, the 12th edition of Modern Dental Assisting by Donnie L. Byrd. There's a great information in this, and I got a lot of my information for this speech inside of this book today. Let's continue. Like I said, adults have 32 teeth, including wisdom teeth. We have incisors, canines, premolars, molars, and wisdom teeth. Normally, a lot of people can go without their wisdom teeth. They either don't grow in and or they get them taken out. They say the best time to get your wisdom teeth taken out is by the ages of 16 to 25. And the reason for that is because a lot of the times they don't grow in until that time, or they don't start to bother the person until that time. Our mouths, we have an upper and a lower. The upper is called the maxillary, and the bottom is called the mandible. Now let's talk about some x-rays. Now you may ask, why do we need x-rays? How many times have you gone to the dentist and you're like, oh, I really don't want to take these x-rays? Well, guess what? The x-rays help the dentist and the hygienist and the dental assistant see what's going on in your mouth. Have you ever wondered what the colors were? So when you see the red one that they put in your mouth, that's called a bite wing. And a bite wing is going to help them see cavities. And then if you see the blue and the yellow, those are called PAs. And they help see the root of the teeth. Not only do they help with the root, but they help with seeing the position, and if there's any type of like abscess or infection with the PAs. Have you ever gone and you stand in this big spaceship machine and it circles around you? That's called a panoramic. A panoramic lets the doctor see the jaw, not only the jaw, but it lets see how much bone you have and the structure of your sinus. With those type of x-rays, they can also help determine if you're eligible for implants. Implants are what you need if you don't have some of your primary teeth. The main teeth that we need are going to be called our molars, and those are the ones in the back of our mouths, and those help us chew. So a lot of the times, if we don't have those teeth, they try to help us replace those teeth, whether it be with implants, partials, dentures. You could even do a bridge. Now let's talk about the surfaces of the teeth. So have you ever been in the chair and you hear the dentist go, 19 needs an MOD? You're probably like, what in the heck are they talking about? So M stands for mesial, which is kind of, if you think about it, in the middle. B stands for buccal, and that's going to be on the side. So when I think about buccal, if you speak Spanish, I think about boca. So it's closest to your mouth, like to your lips. So your boca is your mouth. So buccal, boca. So I always think of it that way. And then lingual is towards the inside of your mouth. And for me, I think language. So we speak with our tongues. So lingual, language. So that's going to be inside the mouth, towards the tongue. Occlusal is the top surface. And distal, well, what do you think distal is? That's going to be all the way in the back, distal. So the next time you hear them say MOD on tooth 19, you'll know that that means meso-occlusal distal. Now, let's talk about some of the procedures. So I just talked about meso-occlusal distal. So that's normally for if you're getting a filling. So we all know a filling is when they go in, they clean the cavity out, and they seal it back up. Beautiful. Sometimes you need more than that. Sometimes you need a crown. So a crown is when the cavity is too big and they don't have enough to just give you a filling. So when you have a crown, they shave down your tooth. They get all the cavity out. They shave it down. Nowadays, they're using something called an eye tower versus an impression. An impression is where they put material on it and you bite on it and then they send it out. So they use the iTero after they clean the tooth up and shape it, and then they send it to the lab. They send you back a crown. But before you get the crown, if they don't make them in-house, they'll give you a temporary. You'll keep that temporary on your mouth for about 2 to 3 weeks. So you come back, you get the crown. They put it in, they take an x-ray, they make sure it fits. As long as it fits, they fit it to your bite and you're on your way. Now, sometimes if a crown doesn't suffice, you'll need an endo, a root canal. So with a root canal, they go in and they clean out the tooth and the roots, and then they pack it. And then you'll normally either do it then, you'll get a crown prep, or you'll leave, come back and do the crown prep. Honestly, it's a long procedure if you're going to do an endo and a crown in the same day, but sometimes it's like, hey, let's just get it over with. But you definitely need to get a crown placed on your tooth after you get the endo. So we talked about root canals, which is an endo, crowns, fillings. There's also implants, what I talked about earlier, and that's when they screw a pontic, it's an abutment into your tooth, and then they put a crown on top. So that gives the space so you have a chewing surface. Bridges is when they take, where if you have a space in between your tooth. So say you have 19 and you don't have 20. So that means you have your molar, but you don't have your premolar, but you have your next premolar. They would place 2 crowns on the teeth that you do have and make another tooth to be a space holder. And the reason they do this is because if you don't have teeth, your teeth will start to shift, and you don't want that. So that's a kind of a simple way if you don't have enough for implant, because implants can be very expensive, and getting a bridge is less expensive. Extractions. So extractions, as long as they're simple, they'll normally do at a general dentist. If not, they'll send you out to an oral surgeon. And I talked about impressions briefly. So briefly, they normally do impressions they could do them for crowns, they could do them for dentures, partials, night guards. Sealants, the hygienist normally does, or the doctor does them. Sealants are normally placed on adolescents, and they put them on their primary teeth so that they don't get cavities until they get their permanents. Because think about it, they have these teeth in their mouth, and if that tooth rots out until they get their permanent tooth, they have no space for their permanent teeth to come in. So they put sealants on top to make sure that they don't get the cavities. There are other types of dentistry, and that's when we go into specializing dentistry. This book didn't go that far into it. So specializing dentistry, like periodontal dentist, orthodontal dentist, and that's with braces and things of those sorts. Periodontals help with the pocket depth. So that's when you're like really bad gingivitis, or your gums. If you notice if your gums are really swollen and you need like a deep cleaning, normally the hygienist will do that. And then if it doesn't heal, they'll send you to a periodontist, and they'll go inside and they're able to like cut your gums open and get in there and clean everything out and then sew them back up and all that good stuff. That was my research speech. I hope you enjoyed it. I enjoyed learning all of this information, and now when I go to the dentist, I know what's going on, and I'm not asking 1,010 questions, and the dentist and the hygienist and the dental assistant are able to do what they need to do. And I think having this information helps everybody else out too, because I'm sure you're wondering, like, why the heck do they always need these x-rays when I come in? So with the bite wings and like 2 PAs, normally they take those every 6 months or 2 a year, depending on if you're high in caries or not. And an FMX is a full mouth, which is about 18 films, and that's when they take a picture of each tooth basically in the mouth. So they get all your roots, they get where they could see if you have cavities, they get your front teeth. So reading that was a great experience for me, and I think that overall health is oral health, and I really hope that you enjoyed this speech and have a great rest of your day.